Hi again. It's your host, Paul Abdurrahman Isadona. Call me Parade and I respond to it. You're welcome to today's episode of Welcome to the Pharmacy. Today is another topic that I'm sure you'll find very interesting and very educative. We are treating the common cold, what we call the common cold. All the symptoms that is associated with the common cold, all the signs associated with the common cold, and the treatments available to you. By the end of the episode, you will know whether you are treating your cold the right way or whether the way you are treating your cold is causing you to cause more havoc to your body. Catch me and my guests after this break. Hello again, welcome back from that break. There are times that your nose are just blocked. You want to breathe, but the air is not finding its way inside your nostrils. Or you just have a runny nose, or an itchy throat, or an itchy nose. Or you are feverish, you have a headache. All these are things associated with the topic we are going to treat, which is common cold. I'm sure all of us have experienced the common cold before. And as this show has taken it upon itself, we are going to bring that topic to your doorstep for all of us to understand what it is and what help you can receive in the pharmacy. So join me, let's go on this ride of education, of getting enlightened on one of the most common conditions that we all suffer at one stage of our life. To help me do this is our regular panelist and pharmacist extraordinaire, Fam Adams Akram. Fam, you're welcome.
Thank you.
How are you?
I'm well.
Everything is fine?
Yes.
Do you have a cold?
No, not today.
When was the last time you had a cold?
I'm sure a couple of days ago.
A couple of days ago. Okay, you tell us what you did that brought upon the cold. But thank you for coming. We always appreciate your insights and the time you take off to be here. Viewers, today too is another lucky day. We have a celebrity guest again who would bring to bear the layman's point of view, as is the custom of this show. I don't think I can introduce him better than himself. So I'll allow him to introduce himself to you, and then we'll take it from there. Please.
All right, so. Ono kongonae, ono kongonae, ono kongonae, lai momo, ene die tinkoli, sheye na wampoli. What's up, ladies and gentlemen? It's your boy Vanilla, an Afrobeats high life singer, and I'm from Boo House Entertainment. I'm happy to be here, sir. Thanks for having me.
Vanilla, thank you very much for coming. That's your voice. Can I come for some training and then because
anytime.
Yeah, I feel like it.
I did for you.
Yeah, if I try to sing right now, the show will end. But
be confident.
I should be confident, Vanilla. Okay, nice to have you. I'm happy. How are you doing? How's everything? How's the music business going? How's it?
Everything is fine.
Okay.
I have a new song out, Prayer. It's doing well.
Okay.
I mean, I'm happy to be at where I am in my career.
Okay.
You know? And it's the fruits of all this that's gotten me here.
Yeah.
I think I've been recognized by you guys and deemed fit to be here. So I'm happy to be here. Thanks for asking.
We'll look for the full one and listen to. Cyclite.
Yeah.
What does that mean?
Toffee.
Toffee?
Yeah.
Okay. So it is sweet like toffee.
Exactly.
Nice to have you. We're happy to have you.
Likewise.
Yeah. I'm sure you are a musician. So in fact, this topic is actually right place for you.
Yep.
Because cold affects your voice and your ability to perform. Tell me, have you ever had any experience with a common cold, and how did that affect what you wanted to do?
Great, you should ask this question. If you were listening closely, I mean, I sound nice, but if you are listening closely, I have a cold right now.
You have a cold?
Yeah.
It means you don't have a music ear.
No. Like, maybe I'll say maybe I'm professional, so I'm able to hide it. Yeah.
Okay.
But I have I don't know, chronic cold, if that's a thing. I almost always have it. one nose or the other anytime.
Wow.
Yeah, so I'm happy to be here. I think it's a blessing.
Yeah.
I'm about to learn a lot.
Yes.
Yeah.
Yeah. But usually when you have, how does it affect? Does it affect your performances? But because today you're able to sing. If you didn't say it, we wouldn't know.
This one is a light one.
Okay.
When you're on stage and you are breathing and all the actions and all of that, it affects you and it makes you sound nasal.
Exactly.
And all of that, yeah. Sometimes if it's quite serious, it affects your throat. Your throat feels constricted and all of that. It's a bummer.
It's a bummer. Yeah, it's a bummer. Fam, why are we saddled with this bummer?
So I think cold. I mean, needless to say, it's the number one complaint you get within the community pharmacy. You have people working in, day out. Well, it's mostly a viral infection.
Okay.
Typically, within the practice, we say viral infections are self-limiting.
Okay.
Meaning that when you have a viral infection, so you probably wouldn't get a lot of drugs to treat viral infections. What we call antibiotics are actually for mainly bacterial infections. You don't have a lot of drugs to treat viral infections. There are certain antiviral medications, but they are not typically for your common cold.
Okay.
So we would say that something like a common cold is self-limiting in the sense that once you have it, the body goes through a phase. I mean, with a good immune system, in a couple of days or a day, you probably would get over it.
Okay.
But there are triggers, of course, for it.
Okay.
If someone has a flu, they are blowing their nose, you're using the same handkerchief, your hands are all infected, you put it back in your pocket, you're taking it out and you're sneezing. I mean, all those things sort of make the symptoms you have prolonged, the sneezing, the itchy eyes. And there are medications that help to block those symptoms. So we call antihistamines.
Okay.
They typically will manifest and give you those symptoms, the itchy nose, the runny nose, the blocked nose, the reddish eyes, sometimes even headache as a common symptom. And there are medications that what they do is they tend to minimize those effects. Other than that, typically what you have is the cold will run its course, and then you'll probably be fine in a few days.
Yes, but for someone like Vanilla, if he has a show this evening and there's an onset of a cold and he says that he gets it quite often, and that's even a question I wanted to ask. How is it that he's able to get it quite often? Is it an allergy? Is it how is it possible for somebody to say I always have a cold?
Yeah, it's possible. The reasons, the ways to get it are varied.
Yeah.
And it may be allergic and or in this period, especially when the weather is changing, all of a sudden you see, if you monitor well in the farm, you see an upsurge in reported cases of the cold or the flu because the weather has changed and then people are sort of reacting. Similarly, if you're moving into the dry season, you notice that change as well. So the weather plays a major, a significant part of it. I mean, in my family, my mother is someone, I always say she has a cold. Every morning, you see her all over the place. And for some people, it's difficult to say this is what it is, but as a viral infection, if it's around you, you get it. Case management around the cold and flus may change because of COVID. When the swine flu pandemic came, it wasn't as serious, so we didn't really, but with the incidence of COVID, things will change because then some of the symptoms that you present, they say someone has a flu, don't get close to the person. And it's changing the way we look at it because maybe the virus has mutated, it has changed in form, it's becoming more dangerous and it can spread in other ways beyond the normal cold we see. But typically it is not a disease, it is not something to be exceptionally worried about. It becomes a cause for concern because people are desperate to get relief. When you have a flu, you want to perform, you need to get some relief. And so you tend to go into the pharmacy as a first point of call to get something to alleviate those symptoms. And that is where some of the issues come up because it's very evident.
Before we talk about the issue, I'm not sorry to cut you, but Vanilla, if you have a cold and you go into the pharmacy, what is your primary concern? What do you want to attain from the pharmacy?
I need something to for relief, like
For relief.
Yeah. So at least because sometimes it's very difficult to breathe.
Yeah.
And very uncomfortable when you're sleeping. For me,
Yeah.
I don't know about So
Yeah.
I just need something. When it happens like that, I need something very strong. Yeah. And
Yeah.
I'm giving a lot of cold relief drugs. I can't say them right now. Yeah, I forgot.
But you're taking so many of them.
Yeah, a lot.
And from I think I'm not sure, but if I was to hazard a guess, that was the point we were going to dovetail into. That he comes, he wants quick relief, and that has some challenges.
And the truth is that in most of the reported cases of cold and flu, when a patient walks in, they are telling you what they want. It's not a case of, oh, I have a flu, what do you have for me?
Yeah.
When you have someone saying that, means the person has tried
Everything
a whole
there is
lot
to
and it's not
try.
getting it, and say, okay, you find something that works for me. But most of the time they will tell you, oh, I want this, I have a cold.
Yeah.
And truth be told, there's a lot of manufacturers are cashing in because there are a lot of fanciful cold medications all over the place. Some of the packaging are so catchy. If you go to most of the pharmacies, the front facing, you see these beautiful cold medications, and people are, once you have a cold, you want relief, and you get it. It works to the most part. There are different ways they work. Some patients may not benefit immediately. Others, once they take it, it knocks it off.
Yeah.
But I think for the individual, there are certain things that you have to do. It's the weather is getting cold these days. You have to avoid extended periods of exposure to the cold.
Okay.
Even in terms of taking in cold beverages, you need to be able to control that. Because once you expose yourself to that, the virus exists in the air.
Yeah.
And it's so easy for it to get to you. Of course, it's not something to too much worry about.
Yeah.
It will go once you get it. But because it's out there, things like that, habits like that tend to expose us or predispose us to getting a cold or flu.
We'll come back and then you'll tell us whether if you have a cold, it's necessary that you take a medicine. Or you said it's self-limiting, you should let it run its course. But what does that mean? If I say I won't take medicine, what do I have to do? We'll come back to ask that question. Viewers, we are taking a quick commercial break. We'll be right back. Yeah, welcome back, viewers. Before the break, we're just diving into the topic of cold and cold management, and we'll explore that topic more. I have with me our regular pharmacist guest from Adam Sakram, and then the beautiful voiced Vanilla, who is a musician with the Bullhouse Entertainment. Yes. And you've already given us some melodious tunes. Before we go, I'm sure that you add some more of that to us to carry on with our day. Exactly. But before we go, have you had any experience in the pharmacy that you describe as your worst pharmacy experience? Let's say worst and best.
Worst and best.
Yeah.
So, well, I don't know if it counts, right? It happened in the pharmacy. So I went to buy a drug.
Yeah.
And I don't know how exactly. So I went for a specific drug. I gave the money out and everything. And when I was leaving, the guy called me back. And was like, I gave him, let's say, 10 cedis.
Yeah.
But I know I gave him 20.
Okay.
Yeah, and he's like, it's like I've underpaid. So I had to add something like that, yeah. And I was so taken aback because, let's say I had only 20 cedis on me. Like that's the money I took from home to the place.
Yeah.
So that's what happened.
So in the end of the day, what happened? Did you pay the remaining?
I had to pay again. Yeah. The guy was very mean.
Yeah.
So I just had to pay.
Okay.
Yeah.
Well, I'm sure by the time we finish this program, you know that the pharmacy is a very welcoming place. That guy is the only one bad not amidst a lot of good
I'm sure he probably projected some feelings from home or something.
From home, and then he decided to come and take your 10 cedis.
Yeah.
Don't worry. Now you are the one. You are the popular Vanilla. I'm sure we don't know where he is. Yeah. So from before you go, I am. I think you are touching on it because one of the issues with cold is that usually the treatment of it is what you call combination treatment. So one drug will have a lot of ingredients because it's targeting the various symptoms. And then sometimes there's the tendency that people will buy one drug and they'll go and buy another drug that will probably have the same ingredients. How do we avoid these things? If you are treating cold, how do you navigate these issues?
Like, so as been the theme in most of the other episodes, the pharmacist or whoever's in the pharmacy plays a critical role. You need to take charge and educate the patient. So, for example, a lot of colds will come with a headache.
Yeah.
But these days, the medications you have, which are for cold combination, most of them have component of medication for headache, mostly paracetamol. If you look well, most of them have it. And so when a patient comes to say, oh, I have a headache, but I have a cold, give me this, and then give me, it's not for the love of just taking money. You should be to the patient, you don't need to take this again, it already has it. Because when you buy it, you probably take more than you need, or you spend money that you do not need to spend.
Okay.
And so that is key, and the people at the pharmacy need to be able to educate the people who work in. But at the center of the management, beyond the drugs that we take, and because of the nature of the infection, if you like, there are things that we can do within our own setting to make sure that the effect is less. So you can buy a drug to lessen the symptoms, but at the core of managing a cold is you need to rest. You need to have a lot of rest. You need to be hydrated.
When you say rest, does that mean staying in bed? Does that mean sleeping? Or what does that mean?
No, not necessarily. So it should be off your routine. Maybe you have a very brisk life, you are all over the place. And I'm saying that because stress can sort of lower your immunity or your immune capability. So giving the body chance to recuperate. You may not have to do anything active, but just having a couple of hours rest, keep hydrated, and by hydration, you don't have to go and take a beer or
I'll come to that.
or some wine.
That's still hydration.
Just water is fine. Even we take vitamin C as a supplement. That does not cure the immediate symptoms you have, but what it does is over time, it sort of boosts up your immune system to be able to respond, and then it can effectively fight off the cold and potentially prevent or prolong your ability to get it again in the future.
At what point should you start getting worried? Vanilla has said that he is almost always on and off, and on and off. Some would say, you've said the cold is self-limiting, which you explained that it will go on its own after a while. But is there a point where if you've had cold consistently, 5 days, 1 week, 2 weeks, is there a point where you should get worried and do something else?
Clinically, I'm not sure there's that defined period, but again, the patient has to trust in the pharmacy. So for example, you have a cold and you feel a certain way, you should go to the pharmacy or your healthcare person. This is how I feel, I do not like it. They would look at what symptoms you have and treat you for it. So if you continuously have it and it's becoming a key, I mean, without you saying it, all you have to do is present your case and your concern as to how frequent you've had it, and then allow or trust the healthcare person to offer you a solution that you're able to help. Sometimes it's beyond medication or drugs. Like I was saying, sometimes you don't need to take a drug. You just need rest. You need to rehydrate. Because a lot of people are in the habit of just going out to buy. There's a popular condition that people don't realize. It's called rhinitis medicamentosa. It just simply means chronic rhinitis, like your nose gets blocked. You use those inhalers to clear it. It will clear it. If you continue to use it, it causes a rebound blockade. So what happens is you get your nose blocked again, not because of the disease, but that is how the drug works.
Hold on. Ooh. So what you're saying is that, but no, ask my question for me. I can see the question I come to ask is what you want to ask.
No, I relate to that.
That point.
That's how come I stopped using
the nose.
Yeah.
It's like when I use it, and it comes right after. But even if I can say worse, like it was before.
Yeah.
So
that's the rebound effect you're talking about.
Congestion.
Okay.
So it's meant to use for a very narrow window. Once you use it, you immediately stop. If you continually use it.
Yeah. When you say narrow is relative.
I mean, so usually those things are for relief. And if I use a nasal drop, I mean, within at max a few hours, you get some relief. You put it aside. You don't need to. But somebody who continuously want to use it. Yeah. Once you use the way the drug works, it will work back and then cause the congestion. It won't be because of the disease, but because of the drug you are taking. Yeah. And these drugs are a combination of multiple drugs. So you finish, you go and you take again. I mean, drugs take some time to get out of the system. So you're accumulating drugs in your system. At the point where it becomes too much, then it sort of becomes toxic to you. And so at the heart of it, there are two things. You have a cold, even though it may be self-limiting and go on its own, but for the relief, for a musician, he may want immediate relief, and there are options available on the market. But you get it and you take it for a short while to get it off. Once it becomes a habit, you can't depend on it, then it's a cause for concern, because if you keep on having the cold, then we have to investigate beyond medication. What are your habits? Like I was saying, you don't use a handkerchief and then you put it back wet in your pocket. It dries, you use it again, and the same thing, you're sort of just reinfecting yourself, because it's virus all over the place. It's easy to catch. And so we have to be careful. Also, within our immediate environment, there are people around us, friends, family, when they have it, we need to have a way. So, thankfully, because of COVID, in most workplaces, once someone has a flu, you are told to stay at home until it goes, because then the person comes to the workplace, it's easy to spread. Before then, nobody cares if you have a cold. It's just a cold. I mean, who cares?
Vanilla, and from I think one of the issues with with treating the common cold in the pharmacy is the issue of antibiotics. And were there any point where, have you ever been told that you need to take an antibiotic for your cold to go?
Yeah, I've taken some before.
You had a cold and you took the antibiotics. Is that the right thing to do?
No, you know, at the very beginning of the show, I said these colds are viral. And you do not necessarily need to take an antibiotic for it, which may be for an antibacterial infection. That is not to say that the cold may not come of other conditions, but of course those have to be determined by a medical person. I mean, because you may have had a cold at some point, you go, the doctor assesses you, does a chest check and sees that you may have a secondary bacterial infection. You may even have a cough in addition. And so based on his assessment and tests, and that culture study, he determines that you have a bacterial infection secondary to your viral infection. And so he treats you for the cold, and then he adds maybe an antibiotic for that secondary bacterial infection for that period. Now it goes off, and the next time you get a cold, I mean, there's no determination that you have a bacteria. You go yourself and say you want to buy an antibiotic. An unscrupulous attendant sells it to you, and you take it. You're just taking it. It doesn't really help. And what it only does is it causes resistance. Because once you continue to use it, at some point the bug just becomes sensitized to it. And so the next time you want to use the antibiotic, you have to go in for something higher, which is what is happening right now. The first line drugs we used to use for antibacterial infections, you use it once, it works. Now we are having to either combine, double the dose, or add more antibiotics to achieve the same result.
That's brilliant. That's brilliant. Vanilla, on the backdrop of what we've discussed, what has your perception of cold changed? Has your perception of the drugs you take changed? What are you taking away?
What really hits me was the rest part, because sometimes I seem to get very unlucky, and like I have the cold in some of my very hectic schedules. So then the rest is the last thing on your mind. But then, like you said, you don't really necessarily have to sleep. You just have to kind of limit your activities, and so that really hits me. So I think I'll find a way, you know, however busy I am, and try.
I mean, I think for his nature of work, once you do it, you're active. Your immunity can drop. He's meeting a lot of people and he's exposed. So taking a vitamin C, one a day, it's fine. It's enough, and that just serves to boost your immune system so that when indeed, which is obvious, you're definitely going to meet the virus, your system is better placed to fight it, and you may not get the symptoms of a flu, as opposed to when you do not, your immune system is not strong enough, then the slightest exposure, you are down.
Okay, viewers, all too soon, our time is up. Vanilla will give us another song to take us home, but let me sign off, and then we'll hand over to Vanilla to take us home. This has been another interesting episode. I'm sure you've learned about the common cold, and that's one, when you have it, don't panic. It's self-limiting. It has the ability to go on its own. There are drugs in the pharmacy that will help you to manage the symptoms. And don't panic and buy one drug today, buy another drug tomorrow. You might be just piling drugs in your system, and that can be dangerous. Two, don't be eager to take antibiotics, which is becoming the norm. Farm Adams explains that can create resistance and will make the antibiotics ineffective, and you have to keep increasing the dose, the dosage, and the quantities, and that is also toxic to your body. The next time you have a cold, when you go into the pharmacy, listen to what your pharmacist say. And another important one, the nose drops and the rebound congestion it causes. Don't just keep putting it in your nostrils. The pharmacist explains that it has a limited period of usage. If you exceed that one, that will rather cause the congestion and not the cold. So you have to be careful in that regard. Thank you, Fam, for coming. Thank you, Vanilla. Yeah. I hand the show over to you. Take us home.
All right, so I'll share my latest single, Prayer, with you. It goes like, everything for change, tables for turn around for me, yeah. Good things come my way, come my way, come my way, come my way. Blessings all the way, levels for the change, oh yeah, yeah, yeah. 'Cause I don't wanna suffer anymore, Baba, just blow me. Yeah, yeah. Shower your blessings, do one for your boy, make a shame person. Whoa, whoa, yeah. Fine cast, no wa mami be. Despite though no wa me baby. Designer no so me be. I love it, I do. Fine cast, no wa mami be. Despite though no wa me baby. Designer no so me be. Me here times two. Things were good, oh. Me I want to. Place where nice, oh, me I won't go. Food where sweet, oh, me I want you, yeah. Shoddy way fine, no, me I want to. Thank you so much. It's been a pleasure to be here.
The last part is the best.
You know it.
Yeah. Thank you very much. Thank you.